Colegas, muy buenos días. Buenos días a
Dear
todos.
colleagues, good
Bienvenidos a este
morning.
webinar
Welcome
Conociendo los hechos,
to
cómo los
this webinar,
comunicadores pueden identificar y responder
which
a
is
la
entitled
desinformación
Knowing the
sobre las
Facts, How
vacunas.
Can Communicators
Mi
Identify and
nombre es
Respond
Leticia Nin,
to
soy la directora de
Disinformation about
comunicación
vaccines?
en la Organización
My
Panamericana de
name
la
is
Salud
Leticia
y
Nin,
es para mí
and
un
I'm
gusto
a
estar
Director of
moderando
Communication
hoy
at the Pan
este
American Health
panel,
Organization, and it's a pleasure to be
un
able to
seminario que
moderate
se
this
inscribe,
panel
se celebra en el marco
seminar
de una nueva edición de
that
la
we are
Semana de Vacunación
celebrating
en las
in a new
Américas
version
y que
of
se
the
dirige a todos
Vaccination Week of the
ustedes,
Americas.
colegas comunicadores y
And
también
we
colegas
are addressing
especializados en
you, the
inmunización.
communicators, and those who
Todos estamos
specialize in
enfrentando un desafío
immunization.
cada vez más
We are
urgente, que es
facing
el tema
a
de la
very urgent
desinformación.
challenge, which is the whole
Un
issue of
punto en lo que todos los colegas
disinformation.
están conectando que
Uh,
les quería
a
avisar.
point I wanted to make
Tenemos
to all colleagues
disponible
as you're joining
interpretación.
us,
Si van
we do
abajo en
have
el panel
interpretation
de la
available.
pantalla van a
If you go to the
encontrar el
bottom of the
botoncito de
screen,
interpretación.
you will
Tenemos
see
interpretación en
a
inglés,
globe which provides
francés,
interpretation. You
portugués
can
y
choose
español.
interpretation in
Así que
English, French,
si
Spanish, or
necesitan
Portuguese. So
traducción en alguno de estos
if you
idiomas, los
need
tienen accesibles
interpretation
ahí. Se
in
los
any
voy a
one
ir
of those languages,
recordando
it
a
is
medida que
accessible there,
avanzamos
and I will remind
con
you
este
every so
webinar.
often as we
Como les
move
decía,
forward.
todos estamos
As I was
enfrentando
saying,
esta especie de gran
we are all
desafío cada vez
having
más
to
urgente,
face
que es
this
enfrentar el tema
major
de la
challenge, which is becoming
desinformación.
more and
Hemos
more
visto
urgent, which
crecer
is
a
the whole
partir
topic
de
of
la pandemia, pero también
disinformation.
ha
We've seen
venido
it
de antes y ha
grow,
tomado
beginning with
distintas
the
formas, ¿verdad?
worst of
Lo
the
que pasa es que
pandemic,
desde el
but it
sector
existed
salud
before
se ha
that.
hecho cada
And the
vez
problem
más
is that in our
patente
sector,
y
health
también
sector, it's
urgente
becoming more and
de
more
abordar.
obvious and a
Y
more
quizás una
urgent
de las
issue
áreas
to
más
address. And one
históricamente
of
afectadas por
the
el tema de la
areas most
desinformación
historically affected
y,
by
y también con un
disinformation
impacto enorme en
and
salud
which
ha
has
sido el
enormous
área de
impact
inmunización.
in
Así que no
health is
había
the whole
mejor
area of
ocasión que esta para
vaccination.
presentar
So
este
there's no
tipo
better opportunity
de
than
panel,
this to have
webinar
this
en el
kind
marco
of
de
a
la Semana de
webinar
Vacunación,
during
focalizado
Vaccination Week
entonces en este
and
desafío que hemos visto
focusing
crecer en los
on
últimos
this
años
major
en nuestra
challenge that has
región
grown in the
y en
last year in
el
our
mundo.
region as well as
Hoy vamos a
worldwide.
tener una breve
Today,
introducción del
we will
doctor
have a
Daniel
brief
Salas,
introduction by
director
Dr.
del
Daniel
programa de
Salas,
inmunización en la
the director
UPS,
of the program
y
on
luego vamos a escuchar una
immunization at PAHO,
presentación y
and then we'll hear a
orientación
presentation
sobre este
and
tema
some
de parte
guidance
de
on the
Loren
topic
Bulanovic,
by
comunicadora
Lauren
experta en
Novik,
inmunización
an
y actual
expert, a
consultora de UPS
communicator,
especializada en temas
and
de desinformación.
consultant
Loren
to
también nos va a
PAHO
ofrecer
on
guías para
disinformation.
identificar
Lauren will provide
qué
some
es desinformación
guides
y cómo
on
enfrentar
what
esto en el marco
disinformation
de
is
la
and
inmunización.
how
Y luego
you
vamos a
can
tener un
address it
espacio de
in the
preguntas
area
y
of
respuestas.
immunization.
Verán al
Then we'll have
final
a
de la
moment
pantalla que hay una
for
sección que
questions and
dice
answers at
Q
the end
y A.
of the panel.
Que es
At
para
in the bottom of the
questions and
screen, there's a
answers,
Q
preguntas
and
y
A
respuestas. Y les pedimos que a
icon,
medida que vayan escuchando
questions and
las
answers. And I'd
presentaciones,
like to
vayan dejando sus
suggest that
preguntas
as the
allí que vamos a
presentations are
tratar de
made,
abordar
you put your
al final
questions there under the
de
Q
esta
and A.
presentación. Ahora sí, sin más, me gustaría
So
darle
without
la
any
palabra
further ado,
entonces
now I'd
al
like
doctor
to
Daniel
call on
Salas,
Dr.
director del
Daniel
programa de
Salas,
inmunización
the
de la Organización
executive director
Panamericana de la
of
Salud.
the
Doctor
Special
Salas.
Program on
Muchas
Immunization,
gracias,
Pan American
Leticia, y
Health
buenos días
Organization.
a
Thank
todos
you
y
very much,
todas. Es un
Leticia,
placer, en
and good
realidad,
morning
darles
to
la
everyone.
bienvenida a
It's a
este webinar
pleasure
que se
to
celebra
welcome you
en el
to this
marco de
webinar,
uno de los
which we are
eventos más
celebrating
importantes en
uh,
vacunación que
in
tenemos en las
within the
Américas,
framework
que es
of
la
the
Semana de
most important
Vacunación
events
en
we
este
have in the
continente, en
Americas, which
esta
is
región, y ya
Vaccination Week
estamos
in the
alcanzando la
Americas in our
23ª
region. This
edición
is
este
the
año. El
23rd
tema
version
para
of
esta ocasión
Immunization
es
Week. And the
Tu
theme
decisión
for this meeting
marca
is
la diferencia, y
your
esto subraya la
your
importancia de
decision
que
makes a
cada
difference. And
acción que
this
tomamos
underscores the
y
fact
el
that every
impacto que puede
action we
tener en
take
nuestra salud individual
has
y en
an
la salud de
impact on our
nuestras familias
individual
y
health
comunidades,
or the health of our
simplemente
family and
basado en
communities,
una decisión que al final la tomamos
based on a
con
decision
información que puede
that
llegar de muchas
we
fuentes o ideas que tenemos ya
make
preconcebidas.
with
En
information that
realidad, las
comes from many
vacunas y los
different
programas de
sources or
vacunación
preconceived ideas.
representan una
In
de las
fact,
intervenciones de
vaccination
salud
programs
pública con
are one of
mayor
the public
respaldo
health interventions
científico
that
y que
have
tienen
the
un mayor
greatest
impacto,
amount
que
of
tienen mayor
scientific
impacto en la
support
historia
and
de la
also
humanidad. Han
have
logrado
great impact
reducir
on the history of mankind.
drásticamente
Vaccinations have
las
drastically
enfermedades, la
reduced
morbilidad, las
disease,
muertes, la
mortality,
mortalidad de
mor-
enfermedades
uh,
infecciosas. Han
morbidity,
logrado erradicar
and
la
infectious
viruela,
diseases.
han
We have
logrado
eradicated
controlar
smallpox.
afecciones como el
We have been
sarampión,
able to
la
control infections such
poliomielitis,
as
la difteria.
measles,
En el
polio,
caso del sarampión y
diphtheria,
la
and
polio,
in the
no
case
tenemos
of measles,
transmisión sostenida
don't
en
have
nuestro continente, en
sustained
nuestra región,
transmission
y
in
esto ha
our
resultado en
continent.
una disminución
And this has led to a substantial decrease in infant mortality, in the death of children under 1 year of age. but the benefit also extends throughout the life course because we have been adding vaccines now for adolescents and adults, such as the HPV vaccine, which prevents cervical cancer, or vaccines for adults who protect adults, such as the flu vaccine. And the effectiveness has been validated by decades of information and monitoring. And the implementation not only protects those who are vaccinated, but collective society, particularly those who cannot be vaccinated for medical reasons. So it gives benefits that cover almost all sectors of society, the productive, educational, tourism, working population, and others. As Leticia was saying, unfortunately, in the last few years, the disinformation has had a major impact on vaccination, and it has distorted the perceptions and ideas of a significant group of people, which makes an influence on the decision they make, which will have a significant impact on their quality of life or even their life. Knowing that preventable diseases or diseases that can be reduced in severity thanks to a vaccine may leave lifetime secondary effects or even lead to death. Also, information or erroneous information on vaccines, even though it may be brief, has a significant impact on vaccination, particularly when that information is erroneous information, and then it affects people's intent of being vaccinated, even among people who have already been vaccinated. That's why we have to address disinformation to improve the population's perception of information. That is why today we have convened you here. In the next 60 minutes, we will explore techniques to get the public to understand why and how disinformation is spread, how the spread of false information is very dangerous and can erode confidence and risk the progress that we have made in public health so far. We are also going to share information on how to detect disinformation on vaccines, and we'll provide some strategies for fighting against that disinformation. This webinar is a call to action to deepen and understand the origin of disinformation, the manipulation strategies, and the tools for verification, and the possibility of listening to society and getting them to understand how they can protect themselves of false information that is spread very quickly. Because we also have to acknowledge that we're living in very different times from 20, 30 years ago, where social networks, internet were just barely an idea and did not exist. Those of you who are specialists in communication are our allies in this. And to make your task more achievable, I'd like to inform you that soon we're going to have some guides and communication materials designed specifically for supporting your work in countering misinformation about vaccines. These materials target different audiences, and they come from different colleagues in communication, from ministries of health, journalists, healthcare workers, and leaders of immunization programs, educators, and others. These resources will be available to you for consultation in 4 languages in the immunization web of PAHO, together with other material. And we'd like to invite you to visit those pages to obtain accurate information on vaccines and counter the misinformation. Finally, I'd like to address misinformation. Of course, it's not a magic solution to increasing vaccination coverage. In PAHO, we'd like to ask you to explore reasons why vaccination has dropped in people or specific people, and the social impact that has affected that, but also the supply of services available. It's crucial to increase access to vaccination and develop effective interventions for this purpose. Thank you very much again for your interest, your dedication, and for being part of this very important conversation in the context of our well-known Vaccination Week in the Americas 2025. Thank you very much, Dr. Salas. A very relevant topic is obviously the impact that false or disinformation can have on vaccination on health, and it's real, and we've seen it. We have examples. Now, why does it happen? What can we do about disinformation as it arises in the area of immunization? For this purpose, I will now invite Lauren Bulanovic, international consultant at PAHO, working in the area of disinformation in the area of immunization, and she will address all the issues, and you will be able to ask any questions you want to her. Remember to use the icon at the bottom, Q&A, to ask your questions. We have more than 100 participants today, so that everybody can be heard. Please use the Q&A. Lauren, go ahead. Thank you. Thank you, Dr. Salas. Thank you to everyone for being connected with us today in celebrating Vaccination Week of the Americas. And I'll be switching to English.
A little bit faster if I present in English. We will share in the chats, maybe Juanjo or Fernando, the links if you are if you prefer to follow the presentation in Spanish. We also have the PowerPoint in Spanish, so you can follow along in the PDF that we'll put in the chat. So thank you so much. It's already been said a couple times today with this webinar, but it's really important. I want to highlight that, vaccine information is very dangerous. It can be deadly, but it's not new. As Leti mentioned, this is a tale as old as vaccines themselves. Ever since Dr. Jenna first had the idea of using the cowpox vaccine to inoculate people against smallpox, there has been hesitancy around vaccines. There has been misinformation. So we're not dealing with anything particularly new, but something that has become more serious and has grown, unfortunately, over the last several years, especially with the introduction of the COVID vaccines. And I'm sure I don't have to tell you that as communicators working in health, I'm sure you all have your own unique stories and perspectives that you've seen from the last couple of years. But as Dr. Salas mentioned, there have now been multiple studies that have shown that exposure to misinformation about vaccines will negatively impact people's attitudes toward the vaccines and their intention to vaccinate. And that is among people who have already been vaccinated before. So a behavior that people have already shown that they can take and have taken, they are changing this behavior when it comes to being exposed to misinformation. And of course, we see a greater impact with this when the misinformation, of course, is making false claims about vaccine safety. So any misinformation that's talking about, the vaccines having unknown side effects or long-term effects or, raising risk of myocarditis or, whatever it is, will increase that negative intention to vaccinate. And also misinformation that sounds plausible. So, of course, some of the conspiracy theories that we saw, especially around COVID vaccines, like, oh, if you get this shot, you're going to be injected with a microchip and become, and transmit 5G wireless, whatever, some of it sounds really far out and people might be, a little bit more not inclined to believe that. But if it sounds scientifically plausible, it has more of an impact. A few notes as we get going. Excuse me. This slide looks a little bit silly in the Spanish, so apologies for that. But disinformation and misinformation, there are actually differences between that. Disinformation is maliciously spread intentionally to cause harm, whereas misinformation is not. People, it's people are benignly trying to share it because they want to share information. They want to alert people, but they're not necessarily trying to hurt. We're using misinformation as the umbrella term here in this presentation. And also, Dr. Salas mentioned this, but it's really important. And so I want to emphasize it again. Human behavior in general, but especially around immunization, is very complex, and it depends on a lot of different factors. And so combating misinformation about vaccines is incredibly, incredibly important and a worthwhile investment in your time and resources, but it's not going to solve everything. So just keep that in mind. as you think about this in terms of your work. All right, so what is vaccine misinformation and how do we spot it? Well, vaccine misinformation is any false information about vaccines, and it is designed to spread quickly. I'm sure you all know it tends to go faster and further than the truth, because anybody can just go out there and say whatever they want about vaccines. And as communicators trying to refute that information, all the steps it takes to, research the answer. What is the correct terminology? Make sure that, you're using the terms correctly, checking with your technical team and experts, making sure it's not too jargony, making your adjustments. It takes time, right? And in the meantime, science deniers are out there just saying whatever they want. They can just invent any old thing and put it out there, and it's out there in the world. But we know that vaccine misinformation gains traction in certain circumstances. Okay, first of all, for those of you who have worked in crisis communication especially, you know that when there are information gaps, and especially in times of crises, if the Ministry of Health or whichever entity that is in charge of this response is not getting information out quickly enough, people are going to fill that information gap themselves, and rumors fly. And that's not just for vaccine misinformation, that can be for any crisis, right? It also tends to gain traction when it's offering a simple explanation for a complex situation. And I think this is something we saw a lot with the COVID pandemic. There were a lot of really big philosophical questions that humankind was asking itself with the emergence of COVID, right? Why is this happening to us? Why are we having to face this right now? And when there is a simple explanation that's put in there, we hear the conspiracy theories. Oh, the big pharma CEOs invented the SARS-CoV-2 virus to sell more vaccines. It's a very, it puts in a nice, neat little box, this answer to this very big question that's hard to grapple with. We also see misinformation going farther when it has a very emotional appeal, or it's very persuasive. And that's something that we talk about a lot as communicators, right? The importance of using emotions, and the science deniers do that very well. We also see it spread when it fits the worldview of people. Humans are very particular. We really like to be correct about things. We like to be proven right. And so maybe you've heard of confirmation bias, wherein we seek out information that confirms things that we already think, or things that we already think we know. So if somebody is kind of questioning vaccines, questioning their safety, their effectiveness, and they see an article pop up on their social media feed that says, it's a false information that says, the vaccines are dangerous, you shouldn't get vaccinated, and they say, aha, I knew it, I had that feeling. So fitting that worldview that people have, it's a great way for things to fly. And it also brings people closer to a tribe, or to a group. And this is something else we saw a lot with the COVID-19 pandemic. People's responses to public health measures, especially early on in the pandemic and as vaccines were being introduced, became politicized, and it became part of individuals' identity. And so when people see a piece of information online, or in their group chat, or wherever it is, and they say, oh, if I share this piece of information, not knowing or caring if it's true or not, they're saying something about their values, about how they align themselves, what they think. And so it becomes a part of, what you're saying as your identity. Where does this misinformation about vaccines come from? Well, anybody really can put anything they want out there. Technology is such that, there's so many platforms and tools. It's really easy for anyone to do it. However, a couple studies within the last few years found that there are a couple of quote unquote super spreaders who are behind most of the misinformation that's online about vaccines. And these folks are making millions of dollars every year by spreading and creating vaccine misinformation. They are selling supplements, vitamins, quote unquote, cures that they say, oh, if you buy my products, you don't need to get vaccinated. They sell books. They love books about, why the pandemic was a hoax, any sort of conspiracy theory you can think of, classes on how to raise your children without vaccines. It's all there. You can buy memberships to access their portals, with all this content. They get paid for speaking. They get paid for, conferences, events that they have. They're making a lot of money by shilling vaccine misinformation and shilling their products. And it's really interesting because they know very well how to use social media platforms, and they have a mutually beneficial relationship, because what do social media platforms want? They want us on our phones or on our computers, scrolling, engaging with content on there. What do the vaccine deniers and science deniers want? They want us engaging with their content and hopefully going to their websites and buying their products, spending money on them, right? And so the social media platforms just see them as driving more traffic to their site and driving more engagement. They don't really have a reason, unless they want to act altruistically, which they generally don't, to stop this. And these content creators who are spreading the misinformation really know how to use the algorithms on the social media platforms to their advantage. So they know folks that, aren't considered anti-vax, but maybe have some questions or some doubts. They know what those questions are, and they really are good at preying on them and manipulating and getting people to engage with their content. And they also can use bots, which will skew the algorithm, because the bots will make it look like, oh, this article saying vaccines are unsafe is getting a lot of engagement. It's getting, a lot of, this must be a very popular thing. I should push this out to more people. So they really know how to play the system and make it work for them. All right, so knowing that it's out there, knowing that some folks are making a lot of money off of it, how can we identify it? What should be on the lookout for? So let's talk about some of the tactics that are used in vaccine misinformation, okay? Think of these as kind of your red flags, okay? If you can learn these, it will help you identify it. And this is not just for vaccine misinformation. This is for misinformation that's out there on any sort of topic. You can look for these tactics, okay? So the first one is anything that invokes a really strong emotion. As I mentioned, especially fear, anger, disgust, superiority. That's again, that confirmation bias of, oh, I knew I was right about that. I told you, or sadness. So, a headline that might say something like, an innocent baby, was tragically died, just months after getting vaccinated. And, you think, oh, just a baby, and it was so tragic and needless, without even going to understand that was the vaccine to cause for that, 99.99999% no, right? But it's that getting that emotional reaction from somebody. Conspiracy theories, we see this a lot with vaccine misinformation. Again, to explain things, that offer that simplified explanation of a complex question, or also, tapping into deep-seated fears or vilifying groups, very, very common. We also see science deniers impersonating experts. They create fake social media accounts that will look like they are the accounts of well-known scientists or government officials or medical authorities. And, so they'll use a picture. If you're familiar with, Dr. Fauci, we saw a lot of him with the COVID pandemic and earlier with all his work in HIV. But, they take a picture of him online, and they might create a social media account that says, Anthony Fauci, and they spell his last name wrong, and maybe they add like some numbers at the end. So it looks like it's an account from this well-known, very respected individual, and they'll have this account saying, I was wrong. Everything I've said before about vaccines, I take back. And so they're making it look like these experts are discrediting vaccines. They will actually also invent people and invent studies to add credibility to their cause. So they will just invent, some random person, call them a doctor and say that their study found, whatever XYZ thing that says that vaccines are unsafe. They also will set impossible standards for vaccines. So if you hear somebody see somebody say, oh, unless that vaccine is 100% effective in preventing illness and it has no risks, it shouldn't be used. Folks, that's a really high standard for anything. That we don't see that with any medication that's on the market. There's a risk for going outside your house and walking across the street. So if we're saying, a vaccine shouldn't be used unless it has absolutely no risk, even when the vaccines that are out there have very, 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 very minimal risks, especially when we compare those to the risks of getting a vaccine preventable disease, but setting this impossible standard, it kind of gives them an out. Well, I can't do this because it's not 100% safe or effective. We don't see that. You don't see that with anything other decision that you make in your life, but you're trying to apply it to vaccines. Appealing to nature is something else we see a lot. That's all the folks that just say, oh, our bodies already know what to do. Our immune systems know what to do. We don't need to give them vaccines. Nature will just, help us, help our bodies. We should just trust them, trust the process. Natural immunity is better. Anything like that is a big red flag. And we also see trolls. So trolls are folks, sometimes they're real people, sometimes they can be bots, but they're online and they're expressing extreme opinions, or they're trying to, egg on, they're trying to stir the pot a little bit, create drama, attacking people who speak up for vaccines. They're trying to, polarize folks on the issue of vaccination and create division. So, look out for folks like that. They are out there, or accounts like that, and keep that in mind when you come across content that they're sharing. We also see anti-vax and science deniers being very selective in their sources. So, if you see somebody say, oh, well, look at this doctor that said that the vaccine's risk of, myocarditis, for example, is too great. So that proves, this doctor said this, and, this is a real doctor. And so therefore we shouldn't be using the vaccines. So if they're talking about this one individual's personal opinion, but not saying that everybody else in the field and all the other data that's out there shows the opposite of that, that's cherry picking, your data, your sources. And it's not a genuine perspective of what the most experts think of. They also will attack experts who support vaccination. So something that we see a lot with immunization is when people say, oh, well, that person's getting a lot of money from the pharmaceutical companies to promote vaccines. And so it's trying to discredit this person's expertise when they say that vaccines are safe and effective and you should get vaccinated. We also see using false logic, and very close, goes hand in hand with that, is relying on anecdotes instead of data to make a point. So, people who use the, N of 1, sample size of 1, well, oh, this person that I know got this shot, got the flu shot and still got sick. So that means it's worthless for everyone. It doesn't work for anyone, trying to take one little anecdote and extrapolate that to an entire population. And this last one, anti-vaxxers and love this type of thing. So this is an example. This is a real headline that appeared in the Chicago Tribune, which is a respected and known newspaper here in the States. And they ran this headline. I know it says March on there. That's when I took that screenshot, but this was actually from when the vaccines were first being introduced. Look at this headline. It says a healthy doctor died 2 weeks after COVID-19 vaccine. The CDC is investigating why. A lot of people, most likely, are only reading headlines. when they're coming across articles on social media or in group chats. So they're not taking the time to go in and read, this is a very ominous sounding headline. And if you go in and, get more information, it's not as ominous as it sounds right there, right? But the reason why science deniers love this type of thing, it's technically true. So other things that I mentioned, you could flag them on the different social media platforms as misinformation. And if the fact checking and misinformation, controls are working as they should in theory, it will hopefully be taken down. This type of thing won't be taken down because it's technically true, but it doesn't go into the nuance of the situation and the truth. And, the reality being, it's not as scary at all as the headline sounds. But anti-vaxxers and people who spread vaccine misinformation love that type of content because it goes really well for them. Okay, so how else can we spot misinformation online? These are, again, none of this take as 100% yes or no, black or white. You kind of have to have you use these to create a bigger picture of things that you should be looking for when you come across an article or, a link to some content that is shared online. Okay, the first are your URLs. If you end in LO, and I want to make a note, very important for CO, that's for more English speaking countries. Does not apply for like Colombia, for example, of course. .offer, .infonet, these tend to be more likely to be, illegitimate websites, right? You want to look for stuff, what more well-known organizations tend to have .com, .org. Again, this is not for everything. These are just, take this with all the other pieces of information that I'm giving so you can kind of have this bigger picture. Snopes.com does keep a list of known fake news websites. So if you have doubts, you can always go back and refer and see if the link that you're looking at is part of that on that list. You can also check the About Us and the staff sections of the website. So you click on an article, seems a little bit suspicious to you. You click on the About Us staff in the corner, and it's either blank or it's, very vague or doesn't really say anything, is nonsensical. They count that as a red flag, right? Some sites will actually tell you that they're alternate news sites or they're conspiracy theory sites or they're hoaxes or even satire, right? So if you see that, then okay, yeah, that makes sense. I shouldn't take this, seriously. Also check the date. Sometimes articles will be, they'll go viral, they'll get a lot of attention, and then years later, they reappear again. And it kind of, create a panic or alarm or something. And, if you look at this was like from 7 years ago, it's not, something that we need to be concerned about at this day and time necessarily. You can also check the byline. So sometimes, you go to click, about the author of this article, and it says, oh, they won a Pulitzer, they won, a Peabody, they have, all just listing all the, very impressive bios. And then you go and you look at this, you Google the name of the author and Pulitzer, and nothing shows up. That's probably not a real person, right? And sometimes these sites can be very lazy and they will use the same picture, the same photo for multiple different authors. So again, just put all these pieces together, right? If you're like me and you love grammar, and you are reading past the headline, right? You're going in, you're looking at the content, and it's just full of errors. There's lots of text in all caps. The article is screaming at you. There's lots of question marks or exclamation points in a row. It's kind of creating this like sense of panic. You feel like, the article is like, trying to raise your blood pressure. That's not something that you see on most news sites, right? Because there's editors and they're checking for, spelling mistakes, grammar mistakes, and they're certainly not yelling in all caps. And speaking of the content, because we are going to say that as communications professionals, especially, right, we are going to read beyond the headline and we are going to see what's actually in there. Sometimes the text is so absurd that, you just know there's no way that this can be real. I saw an example where they had attributed a quote to an animal. They had said that, Happy the dolphin, or somebody had said this. I mean, clearly, right? And again, the made up experts, the made up organization, made up quotes, organizations, data, figures, all of that. Those other tactics that, I was just talking about, they will use that in the content. And so that, that might take a little bit of effort and time to go and, counter that, check that with, government agencies, from UN agencies, other agencies that work in this field, and see, does this line up or not? You can also look at the links in the article, if they're broken, or if they're going to other, suspicious websites that say, conspiracy theory website or alternate news, red flag. You can also check at the images. If they look like they very clearly have been edited, they're warped, they're blurry, they seem AI generated, they look just, a little bit off, maybe the hands look weird. And sometimes, if it's a stunning image, you can do a Google reverse image search and see, because they're not super concerned about integrity, and it wouldn't be super abnormal for them to be stealing real images from other websites. And finally, you can click around within the website, see if there's other stories on there that look suspicious or nonsensical. So if you initially, click on something that makes a claim about vaccines, and the other stories on there are about, alien abductions or other, just very out there type of content, that's a red flag, right? You can also look on the platform, the type of interactions. So if you're seeing a lot of comments that seem to be from bots, where everybody's saying the exact same thing over and over again, or for trolls, that can be a red flag. Although do note that it's not uncommon for trolls to go after pro-vaccine content as well. So again, I cannot say this enough, just take all of these little pieces and try to create the bigger picture, and when you're doing this detective work. And finally, check your biases, right? We talked already about confirmation biases. So, if you see a piece of content, and it's, evokes a very strong emotional appeal, and you have that, aha, I knew I was right. Just check your suspicions for a minute, and look at these other things that I've mentioned before you just know automatically that, and share this content with everyone. Some fact-checking resources that I can recommend: Snopes, as I already mentioned, BBC Verify, PolitiFact, factcheck.org, all do quite a good job of staying on top of current events and misinformation that's circulating. And some of them even have sections that are specifically related to health or immunization. So definitely, if you come across a piece of misinformation that seems, just a little bit suspicious, check it out on there. Okay, so we have seen there's a lot of vaccine misinformation out there. Some folks are making a lot of money off of it. They are very good at tricking us. What can we as communications professionals do to fight back? First of all, we're going to be doing some listening, some social listening on vaccines, because we're not talking about just information diffusion. We're talking about communicating, which is a two-way process, right? So we are sharing our information, but we're also listening to what the other side has to say and what people are saying or thinking in response. So we're going to be looking at, for example, on social media, the vaccine and immunization related hashtags and social media accounts in your country. So follow those. Also make sure you're following the pro and anti-vaccine accounts, social media accounts, blogs, whatever, because you want to see what both sides are saying. And any viral content that has to do with immunization, make sure that you are staying on top of it. You also want to look into your legacy media, what's being said on TV, radio, and the newspapers, magazines. What type of questions are being asked about vaccines during press conferences? Same thing with, hotlines, contact us pages. What are the types of questions or, things being reported that you are hearing on those? And health workers, if you've heard me talk at any other webinar or presentation about trust in the immunization program, or communicating about vaccines, you've probably heard me talk about the importance of working with healthcare workers, and they are really the boots on the ground in terms of not just administering the vaccines, but also hearing what's being said about them. So if you can establish a mechanism of some sort for them to report back to you, because if they're all of a sudden having patients come in and everyone's asking the same question, or the same rumor that they've heard about a certain vaccine, that's a sign that something needs to be done to address that, right? So having that form of communication with your EPI, just to know what they're hearing and what they're seeing on the ground, and also the two-way again, right? So making sure that they're equipped to be able to respond to those. Okay, so after you do your social listening, or as you're doing your social listening, because this is an ongoing thing, it's not something we do once and say, okay, done, did that, all set. No, we're doing this continuously. One of the approaches that we have is called pre-bunking. And I really like this quote. This is from one of the creators of a game called Go Viral that we'll talk about in just a second. But she's saying, by exposing people to the tactics behind fake news, we can help create a general inoculation rather than trying to counter each specific falsehood. And so pre-bunking is something that happens before somebody is exposed to misinformation about vaccines. Think of it as a vaccine. You are preparing them to be exposed to misinformation at some point. Pre-bunking can also actually be therapeutic, in that if someone has been recently exposed to misinformation, but it hasn't quite sunk in yet, they don't quite believe it, pre-bunking efforts will work with them too, okay? Pre-bunking, how does it work? So first, you're going to give folks the warning. There is misinformation about vaccines circulating. You're going to share the truth that you want them to know. So this will depend on what you're talking about, right? But not also, according to the audience's needs, according to, how they want to receive this information, right? So you're going to tell them the truth about the vaccines. You're going to share a very weakened version of the myth. So you're not going to go into all the details. You're not going to be giving this false information any extra attention. It doesn't need that. You're just going to give them just enough so that they know what you're talking about. So when they see it or hear it, they say, oh, yeah, I heard about that. That's right. Okay. You can point out any misinformation tactics. So anything that I had just talked about in the first part of this presentation, like, oh, did you see how this, preys on your emotions? Or do you see how, they're trying to blame everything on one specific group? It's a conspiracy theory, right? And then you want to repeat the truth again. So it's kind of like a sandwich where, the truth is really, you want to start and you want to end with that. When you work to increase media literacy, digital literacy, health literacy with your audiences, you will have more success with your pre-bunking efforts. And that's why the quote that I just read is so important, because it keeps you from having to be playing whack-a-mole with every piece of vaccine misinformation that's out there. There's a lot of it. But if you can kind of teach people how to spot it, how to be aware of it, and teach them, increase health literacy, so they can also, when they are exposed to vaccine misinformation, the sirens go off in their head. They think, no, I don't trust this, or this seems off to me, or, this does not seem right. You will be more effective with your pre-bunking. There are already some great pre-bunking resources that are out there. These are available in multiple languages, including Spanish and Harmony Square, I know at least, or bad news is in Portuguese as well, and French. So these are games you can play online, and they are actually teaching you about the tactics that are used in spreading misinformation, and in a fun and entertaining and engaging way. Cranky Uncle is the only one that doesn't have any necessarily, health related things. That doesn't go into immunization. It's very focused on climate change, but it's the same principles, and it actually has like an entire curriculum, so it can be used in classrooms as well. But if you can share these games with your audiences, and it's a good way to teach those skills. Now, what happens if somebody has already been exposed to vaccine misinformation? Then you need to debunk. Okay, so debunking is a little bit trickier, because the more amount of time that has passed since someone has been exposed to vaccine misinformation and the time that you come in to debunk it, the harder it is. Misinformation is super sticky. It stays in our brains really well. And so it's harder to correct. So with debunking, what are you going to do? You're going to lead with the truth again. You are going to, when you are talking about the myth, you are going to make very clear that it is false, it's misinformation, it's a lie, it's, whatever it is. So if you're doing this visually, you want to make a very strong visual cue, write big false on it. If you're doing it, if you're talking, repeat time and again, don't mention the myth without saying that it's false. You can again say why it's not true. Point out any tactics, digital media literacy, and then you're going to end with the truth again. There was a time when folks thought we shouldn't debunk, because you're actually bringing attention to something that's not true. Studies have shown, and that's known, that the backfire effect. But studies have shown we should not let fear of the backfire effect stop us. It's not a big real thing, and it's better to debunk. We can't just, ignore the misinformation and hope it goes away. It won't. All right, so let me try and go through these really quickly. In general, when you are correcting vaccine misinformation, you want to be as kind, non-judgmental, and empathetic about it. Do not shame people. Shaming does backfire. People who feel shamed about their decisions not to vaccinate are just going to dig in deeper with that decision. As communicators, we can use emotional peer appeals to make our content in favor of vaccines more appealing. The one exception there would be fear. That does also tend to backfire as well. Not all the time, but it's something that you need to use caution with if you're going to try and create content based on that. Similarly, if there is a science denier that is really just, a thorn in your side, constantly sharing misinformation, constantly out there telling lies about vaccines, go after the lies, not the person, because people who have listened to this person before could feel attacked themselves if you attack that person, because they're going to say, well, I've listened to this person before. Are you saying now, and you're calling them dumb, you're calling them, whatever. Are you calling me dumb as well? So go after the content, not the person. Any type of content that you're putting out there, use visuals where you can for pre-bunking and debunking. Studies have shown that it could be just like a photo of a doctor or a nurse. You can use like graphs or, charts. Any of that is helpful. So, the world is your oyster, and any type of visual content supports. And as always, don't use, super technical jargony language. We don't want to forget video-based platforms, because misinformation is rampant on there. I know it's a little bit more labor intensive, cost intensive to make videos, but there is false information about vaccines on TikTok, on Instagram Reels, on YouTube Shorts. It's all out there. So we have to be on those platforms as well. Don't create collateral damage with other vaccines. What does that mean? That means if there's a piece of misinformation out there where somebody's saying, don't get the flu vaccine because the flu vaccine uses mRNA technology. We don't want to go out there and say, No, that's not true. The flu vaccine doesn't use mRNA technology. You know, we are accidentally, if we are focusing just on that, we are throwing mRNA vaccines under the bus. So we want to make sure you can correct, you can say, that's not true. The flu vaccine doesn't use mRNA. It's a technology platform. But also, there's nothing wrong with mRNA vaccines. They're also safe and effective, et cetera, et cetera. So it's about creating that balance. If you're trying to specifically correct misinformation among health workers, if there's some hesitancy there, studies have shown that it's more effective to highlight the scientific consensus in favor of vaccines to reach them. So, you know, focusing on the evidence, and that most scientists, most of their colleagues, most peers do support vaccination and you know, say that it's safe and effective. And we do want to be transparent about vaccination related risks. We have a whole, PAHO has a whole guidance on that. So check that out if you want to learn more. But always put these in the context of risks of not being vaccinated. And finally, pay attention to the root of the misinformation that is circulating in your audience. Okay, take a step back sometimes and think, you know, what is this telling you in general about the public's concerns, their level of trust in the immunization program, but also in the health system at large, and you know, what else is going on. You're also going to want to provide quote unquote boosters to protect pre-bunking and debunking efforts. So just like social listening isn't something that we do once and say, you know, check, we're done with that. Pre-bunking and debunking, you're going to want to have to keep doing that with your audience because we've seen that the effects of that tends to fall off after even, you know, a month or two sometimes. And misinformation needs other people to spread it. So as I mentioned before, when we were talking about pre-bunking, do what you can to strengthen media and health and digital literacy, but where you can, so that people, when they see the misinformation about vaccines, instead of spreading it and sharing it, they stop it in its path. Last slide. Collaboration is key. Multiple studies have shown that when it comes to vaccines, the audience perception of the trustworthiness of the source is as important, and sometimes more so, as the perception of expertise. So if you have somebody coming in to debunk or to correct misinformation about vaccines, it is more important that the audience trusts that person than that the audience sees them as an expert, okay? And health workers do tend to be the most trusted sources of information on vaccines and vaccination. So working with them, like I mentioned before, with the social listening is really important. And also seeing how you can offer them training in terms of communication and debunking and pre-bunking, you know, whatever it is. They have a lot on their plates, as we know, our health workers do. And so we don't want to overwhelm them, but we do want to offer them, you know, resources so that they can respond. And PAHO does also have a ton of stuff out there for them as well. So please check that out. And you can also think about other leaders and influencers that you can work with to help you get messages out there to combat vaccine misinformation. And again, offer the training, trustworthy resources, you know, how to find fact checking, because studies about influencers have shown that, you know, maybe not super surprising, they're not doing a lot of research before they're, you know, sharing their hot takes on social media. So I will end it there. Thank you all so much for your attention, and back to you, Letty.
Thank you, Lauren. Thank you for this wonderful presentation. I'm gonna switch to Spanish now. Gracias, la verdad que
thank you.
creo que ha sido
And it's
súper
truly
profunda, y vemos las
been
reacciones
a
de
real
los
deep dive in
participantes en
discussions on
en
this, and I
webinar.
see we've gotten a lot of
Quería
feedback
sí
from
comentar que hay un par
participants.
de preguntas,
Now,
hay
I see a couple of
comentarios
questions,
sobre
some
tu
comments
presentación.
regarding your
Pero
presentation,
mientras te
but
doy tiempo para tomar un poco de agua,
as I
sí,
just give you a minute to
de
maybe
nada.
get some
Te
water,
quería
I
preguntar si nos
would like
podías
to
contar a
ask,
todos cuáles son esas
maybe you
guías,
could
esos
discuss
recursos
what are
adicionales
some of
que
those
van a estar
additional
saliendo pronto de
resources
tu
that are
experiencia, que sé
going
que
to
has
be
tenido que ver.
coming out
Y les
from
recuerdo a
PAHO.
todos los
And I just
participantes
want to remind
que
all of the
la
participants
presentación
that the presentation is available both in Spanish and English, and you can find it in the chat box in this webinar. I see some of you have already done that. Lauren, go ahead. Thank you, Leticia. And yes, the materials are available and have been published, including the editions with design. We have, for example, one for communicators, for you who are connected. We also have another guide for educators that can be used in the classroom and to promote for parents. That's for the teachers. And then we also have a guide for the managers, and this looks at, for example, hesitancy among workers. And I know that this is a topic that we need to be very much available to address and be aware of. We also have a lot of fact sheets, but they're more like pamphlets. There's one for journalists, a fact sheet for journalists, and another one for influencers. So this package of information will be available at the PAHO website in the toolkit, and that's available already. We can include that link in the chat box. In the meantime, it looks like audio, there's no audio right now. I'm not sure what language they're talking about. Hopefully they'll be able to hear the original. There's a couple of questions. Federico talks about how can we provide more information regarding more information from the pharmaceutical sector. Maybe it's not up to that sector, because that could have a negative impact on the messaging. Well, that's a good question, and it's a difficult one to answer, because if people are suspicious, and they may be suspicious or apprehensive in terms of this source, the pharmaceutical industry, because everybody's going to try to sell their products. But as far as working with creating partnerships and cooperating at the local level, working with pharmacies and health workers, I'm not sure what else we can add in our discussion to that. Well, this could be maybe a joint undertaking. Maybe the industry could also monitor and see exactly how this is having an impact on trustworthiness as far as vaccines. It would perhaps just lend one more voice to the discussion. We also have a question from Ronald Alvarado.
False expert opinion and how to fight infodemia. Bueno, creo que muchas de las respuestas son
I think many of the responses look at how to better address infodemia. But here the focus is looking at how to prevent false expert opinion, quote unquote. It's in quotations, yes.
So I'm guessing maybe that we mean like a fake expert, like an invented. You know, it's the same thing that we would do for you know, other detractors of vaccines, right? You know, it's the same thing. You're going to want to go in and you're going to want to say, and again, I really caution you to be really careful if going after an actual person and naming a person, because like I said, that can backfire. So if you are, you know, tempted to name a specific expert, whether that expert is real or somebody you don't consider an expert, just be really careful with that. Again, focus on the content, focus on what they've said and counter what they've said. Don't, you know, go after the fake quote unquote expert themselves, because again, anybody who does respect that expert, who wouldn't put the expert in, the air quotes, is going to feel like you are, judging them or feeling attacked by you. So avoid that.
Gracias, Lauren.
Thank you, Lauren.
Otra consulta más.
We have another question here from Lourdes Ramirez, who says recently all of these cases are attributed to COVID-19 vaccines, especially those of AstraZeneca. How do you respond to friends and family? And I don't think it's been in all cases. I've seen in some region there might have been suspicion about it, but it wasn't clearly determined whether there was a direct link.
Sí, no sé,
I,
esta pregunta
well, the
prefería, no
question,
sé si alguien del equipo de
and I don't know if
vaccine
somebody
safety está
from the
conectado.
vaccine safety
Creo,
group
pero,
is has logged on, but
hay dos
cuando-
elementos, uno que
there
es
are
la
two
parte, digamos,
components.
de safety, como decís tú, de seguridad en torno a
There's
la
the
vacuna y en particular
vaccine
con el tema
safety
COVID y después
aspect,
también está el otro
and then
componente
looking at
de
it in the context of
cuál
COVID.
vacuna, ¿no?
And then it's
Sí,
also a question of which vaccine.
Cuando justo estaban saliendo todas las vacunas para uso
When all the
la
vaccines were
población,
being introduced
nosotros
and
estamos
distributed
diciendo
among the
todos,
communities,
de
we
hecho,
told
hicimos una campaña
everyone,
en lo
in
PS,
fact, that we launched
que
an
la
awareness
mejor
raising
vacuna
campaign
es la vacuna que esté
that
disponible.
the
O sea,
best
si es la
vaccine is the one
vacuna
that's
que
available.
usted tiene, que
If
está ya para poner en el
the
brazo, ya, listo,
vaccine
vamos
is
con eso.
ready
Porque aun
to
con
be
los
administered, then that's the one to
riesgos,
use.
aun con los
Because
SARIs, digamos, los eventos
even
adversos
with
atribuidos
potential
supuestamente a las
adverse
vacunas,
effects associated
las
with
vacunas no se
vaccines,
aprueban si tienen
vaccines are
nivel de
not
riesgo más alto que su beneficio,
approved
¿no?
if
El
there's a
nivel
high
mucho más
risk
grande.
level. It's
Así
got to be
que yo creo que
a
cuando
much lower. So
si su amigo o sus
if their
familiares tienen
friends, their
miedo de
family
eso, poner en perspectiva
are
los
concerned,
riesgos, ¿no? O
we
sea,
need to
sabemos los riesgos de
place
la COVID.
these risks in the proper
La gente se muere
perspective.
de la COVID. La gente
People have
termina
died
con
from COVID.
efectos que
People have
duran
had long-term
meses, años,
effects
no después.
lasting
O sea,
months and
sabemos
years.
los riesgos de la COVID
So
son muy
we have
grandes y
weighed
son
all
muy
of these
serios.
risks,
Los
and they're
riesgos
there,
de la vacuna
but the risks associated with
son, a
vaccines
veces sí
are,
existen, pero no son muy
yes, they
fuertes,
may
no son muy
exist,
grandes.
but
Y en
they're not
comparación
significant
con con el
compared
riesgo que da
to
de
the
enfermarse con COVID, son mucho, mucho,
risk
mucho
of
más
getting
grandes.
sick from
Si tienes
COVID.
o si quieres más detalles
If
sobre
you
eso,
want more
de
detailed
comunicando sobre los
information
riesgos de la vacunación, tenemos una
regarding
guía que
the
publicamos
vaccine and risks
el año
associated,
pasado, o
24.
hace 2 años, sí, o sea, año pasado,
last year,
que está disponible en la página web. También
the
hemos hecho
information is
webinars
available on our
sobre este
website. We've
tema,
also hosted
y
several
las
webinars
grabaciones están en
on
la
this
página web y puedes
topic,
entrar y
and
leer
they
todo.
have
Hay
been
una
recorded
metodología
and
y
they're
hay también los
available.
consejos muy
There's a lot
concretos
of
de cómo hablar de eso,
comprehensive
pero no
information,
sé si
and
podemos poner este
I don't
material
know
en el chat también.
if we could include that in the chat
Ni
box.
interesa el tiempo porque ya, no sé, nos pasamos un poquito desde las
We're
11.
a little bit
Tenemos
over
3
time.
preguntas
So
más.
let's
Voy a
take 3
tratar
more
de
questions and then
encapsularlas. Hay una
and
que
I'll
habla
try to
de cuáles son
summarize
los
them.
recursos,
One
si hay
asks
recursos
about what are
legales para
the
reducir la
legal
desinformación
resources
sobre
to
vacunas desde
reduce
los organismos públicos de salud.
disinformation on
Supongo que eso
vaccines
dependerá
from
un
the
poco
public
del país, que eso va hacia
health
legislación
organization. I think that
nacional, si es que
depends on the
hubiera alguna,
countries and their
y con
national
mucho cuidado
legislation.
porque también se puede
And
dar vuelta,
you have to be careful even with that
puede dar
because
vuelta la narrativa.
it could
Otro
change,
colega
they
pregunta,
could
¿qué opinión
change the
tenés
story.
sobre el tema de
Another
los
question, what's
profesionales
your
de la salud
opinion
que no están
on health
convencidos, no
professionals that
consiguen
are not
convencer
convinced?
sobre el
How can
beneficio
we
de
convince them
vacunas y
about the
también el
benefit
número
of
público de
vaccines?
salud? Y creo que eso ha sido
And
un tema, ¿no?
we
Que han
do have
trabajado
people
los
in health
trabajadores de
working like
salud,
that.
digamos, como
And it's
campeones
issue. They're
de
health
estos
workers
temas.
who
Sí,
should serve as the champions for
sí,
our
la primera
issues.
cosa que
Well,
debemos
the
tomar en
first
cuenta
thing we
es
need to
que
take into
los
account is
profesionales de
that
salud, los trabajadores de salud
the
son
health
humanos
professionals
como
are human
nosotros
beings,
y
just like
tienen sus
us.
propias
And they have
preguntas y
their
dudas
own
y
questions, their own
están expuestos
doubts,
a la misma
and they're
desinformación
exposed to the
que
same
nosotros estamos viendo,
disinformation that
están en los
we
mismos
are seeing.
chats
They see the same chats. And there have been several studies done that have tried to investigate why are we seeing resistance amongst health workers and what can we do. In one of the guides we're going to publish for EPI managers, and because the guide for health workers is more for health workers and how they should speak to their patients, but we're publishing another one for EPI managers, and it includes a whole section on this specifically. So it talks about what you can do if your own team workers are showing reluctance or resistance to vaccines. So what can you do? One, I already mentioned, is to emphasize the scientific consensus about vaccines. That is something that reaches out to them more than anything else. Studies have shown that there are other initiatives that can be used at health centers or clinics in terms of increasing confidence amongst health workers. There are many, and I don't have a lot of time, but there's a whole section that I wrote about that in this guide I mentioned. Now, if you have a conversation with a colleague and that person has these questions or doubts, it's very important to address them with empathy. Don't judge, be open-minded, leave the door open, because it's not something where you're going to be able to solve it quickly. So you have to leave the door open to continue talking about the issue. But there's been a lot of research done on this topic. I wanted to call on Dr. Salas now, who had raised the hand a while ago. I don't know if it has to do with this specific topic, vaccine safety. Dr. Salas? Yes, the first thing I'd like to point out is that with the COVID vaccine, as happens with many others that have been applied to a very large section of the population, in the case of COVID, it was given to almost the entire population at the very outset. And it's very clear that when you give a vaccine to the entire population amongst young people, there may be, for instance, an inflammatory reaction or some heart problems that could be taking place, either because of COVID itself or for other reasons. But when you do a vaccination in such a massive manner, there are some people who, for instance, they were going to become diabetic, and people say, oh, no, it's because they had the vaccine. So a lot of, particularly among young people who were going to have a health issue, they may say that it's caused by COVID, and the anti-vaxxers use those coincidences as a demonstration of the fact that they cause these problems. I'm not saying, of course, that vaccines are completely innocuous, because like any medication, when you buy medication in the sheet inside, it tells you all the risks that could affect you, but it's always a very small percentage of the population. But any medical intervention or drug intervention has a risk. But in the case of vaccines, it has been demonstrated they're very safe. And the adverse events we've seen, most are local in the injection spot. It may cause some transitory pain, but those effects that are just temporary indicate that the vaccine is developing the antibodies in your immunity system that will help you combat the big threat, the virus, when it enters your body. So we have to work on that. At PAHO, we're working on how to educate, how to have health workers feel more certain about what vaccines do, that it's based on a scientific scientific method. If they went to university and they have been taught that medicine is based on scientific evidence, then they will understand this. So we are creating material and strategic material to counter that lack of trust that some health professionals may have about recommending the use of a vaccine. And of course, some, as Lauren said, take advantage on becoming popular. Some doctors see this as a benefit, that they become heroes, and say they don't necessarily believe in this. They just feel that this way they can make a lot of money. Thank you, Dr. Salas. Thank you, Lauren. I see there's some other comments. Thank a lot of interest in working on this vaccine hesitancy and many other initiatives. We've already gone over by quite a few minutes. So thank you again to everyone for having participated. Later on, you'll have access to the recording of this meeting. And I thank you for having taken the time to be here to listen and sharing your views on how we can address disinformation in the area of immunization. There are more resources coming on board to support you, as we said earlier, and we will continue to work on these topics together with you. Again, thank you to Lauren and Dr. Salas. Thanks to all of you who are behind the screens helping us set up this webinar. And again, thank you to all the participants. We will keep in touch. Bye.